Hello, everyone. I am Shriti Raj. The paper that I'm presenting today is called It Can Bring You in the Right Direction, Episode-Driven Data Narratives to Help Patients Navigate Multidimensional Diabetes Data to Make Care Decisions. Continuous self-monitoring and reflection on data is known to improve the management of chronic health conditions such as diabetes and hypertension. As a result of improved sensing technologies, patients can now easily track different types of data about them. And given the right tools, they could use this data at home or with their clinicians to identify and act on issues as they happen. Data can help make informed decisions on a continuous basis, which can eventually improve health outcomes. While the ability to track data has improved, leveraging the tracked data to make care decisions remains a challenge, particularly for patients. Patient-facing tools focus on single streams of data and provide limited support to interpret multiple data streams, making it all the more challenging for conditions where several relevant factors need to be tracked. Additionally, tools are often critiqued for being burdensome and for providing limited actionability. Given these problems, there is a need to create better tools to help patients act on their health data. To address this need, we conducted two studies, one to understand people's existing practices and challenges around the use of data to inform self-care, and another to design and evaluate a novel prototype, which we call episode-driven data narratives. In study one, we examined practices by observing and analyzing 71 data review sessions between type 1 diabetes patients, their caregivers, and clinicians. In the diabetes data review sessions that we observed, patients and clinicians used data reports from commercially available diabetes device platforms, which are PDF reports that compile multiple types of visualizations, some of which you see here. These reports, as can be seen, are complex, making data review a time-consuming and a challenging process. This complexity often discourages patients from using their own data to inform self-care, compromising glycemic control. Based on these sessions, we found that making decisions from multiple streams of diabetes data involves 5 tasks. These include identifying one or multiple episodes of suboptimal management, for instance, identifying patterns in the blood glucose data or patients' behaviors, explaining an episode in terms of one or multiple potential causal factors, invoking episode-specific domain heuristics to find representative evidence for an episode for deeper analysis and discussion, assessing episodes for interventional need and feasibility, and lastly, selecting potential causes to work on to fix an episode among the many causes that were identified. Based on these tasks, we identified 3 design goals to support the use of multiple streams of data. First goal is to support multiplicity by presenting multiple episodes and factors and helping patients prioritize among them. Second is to support analytic focus by using episodes as a basis for data selection and presentation. Third is to use heuristics to contextualize representative data for an episode and explain episode factor connections. Following these design goals, we created novel prototypes called episode-driven data narratives using the Wizard of Oz technique. We developed visualizations from real patients' data and integrated these visualizations into an interactive prototype. Episode-driven data narratives consist of 3 components. First is the data overview, which lists the episodes present in the data. Users can click on one of these episodes to go to the detailed view of an episode, which shows a comprehensive visualization of the episode, followed by the episode characteristics. Lastly, it lists the factors potentially associated with the episode. Users can click on one of these factors to see the detailed view of a factor. The detailed view of the factor shows episode-specific domain heuristic, explaining the connection between that factor and the episode. It then shows examples from the pump data to demonstrate that particular connection. In our evaluation, we compared our prototype with reports from commercial diabetes platforms using task-driven data review. We conducted 2 sessions. In the first session, participants reviewed the commercial PDF reports, and in the second session, they reviewed the prototypes. In both these sessions, participants first completed a task-driven Think Aloud data walkthrough by taking a data comprehension test customized to the data they reviewed. Next, they completed the NASA task load assessment to measure the burden of engaging with data with different platforms. Last step was a semi-structured interview. These sessions were conducted on Zoom. they were video recorded, and they were transcribed for analysis. For data analysis, we compared the comprehension test scores and task load scores for the two platforms. We also analyzed the transcripts to identify the types of information used for the tasks identified in study 1, the challenges of answering questions on the comprehension tests, the perceptions about the two platforms, and the similarities and differences in the responses from the two platforms. A total of 8 participants completed the 2 sessions. Among the 8 participants, there was one caregiver of a pediatric patient with type 1 diabetes. The other 7 were adult patients with type 1 diabetes. We found that episode-driven data narratives resulted in better data comprehension and lower task load as compared to the commercial platforms. Comprehension test score for the research prototypes was significantly higher than that for the commercial reports. Task load score for the research prototypes was significantly lower than that for the commercial reports. Episode-driven data narratives also improved actionability, meaning they enabled better translation of data to self-care actions. Here's an example of P10. When answering questions on the comprehension test about the changes that he would make, he was unable to list any changes when using the commercial PDF reports. In the free text response, he said, any. For the same data, with the episode-driven narratives, he was able to articulate a plan of action. In his responses, he wrote, increase basal insulin gradually and see if changes improve over several days. Also take dinner meals earlier and take insulin 20 minutes before dinner. Episode-driven data narratives further improve decision-making and engagement with data by enabling user agency in navigating the multiplicity involved. For instance, participants used different types of criteria to decide which factor to consider changing among the many that were listed. In other words, participants did not necessarily choose to work on a factor that was the most influential. This was facilitated by the different types of information presented in the prototypes. P4, for example, chose to work on a factor for which there was evidence on what worked. He did so based on the examples shown. He saw a good day and a bad day in relation to frequent eating, also shown here on the right. This helped him identify a concrete thing to do with certainty, which was eating less frequently, as can be inferred from the good day. He mentioned, I was kind of more convinced by the fact that this had like an example of where you did what you would do to fix it, and it worked. In another example, P1 chose to work on a factor that was easier to work with. She looked at 2 factors shown on the right and decided to go with the evening carb ratio. She said, I might probably do the carb ratio because it would seem like it would be the easier of the 2. She had a condition which made it difficult for her to avoid frequent eating. Based on our findings, we identified 3 design implications for tools to support the use of multiple streams of health data. First is the need to constrain the space for unnecessary exploration that can happen when reviewing multiple data streams. We enable this by using episodes as a basis for data selection and presentation. Through episode-driven data narratives, we provide a novel approach to curate and present health data and insights. Second is the need to enable just enough exploration of choices. We saw that choices, instead of overwhelming the users, enabled decisions that were aligned with users' needs and increased participants' comfort in making decisions. Tools thus must enable such exploration of choices by designing beyond directive recommendations, which could restrict helpful data exploration that is necessary for users to feel comfortable when making decisions related to health. Third is the need to show evidence-based explanations. Our participants used different types of data examples for different benefits. Tools can use insight-specific examples to improve value generation from data. In summary, we articulate data-based tasks performed by patients and clinicians to make decisions from multiple streams of diabetes data. We design and evaluate novel data interfaces called episode-driven data narratives to enable interaction with complex health data. We show that episode-driven data narratives improve data comprehension, lower user burden, enable user agency, and improve actionability as compared to commercial diabetes data reports. Lastly, we provide design implications for patient-facing informatics tools to enable care decisions based on multiple streams of health data. We would like to thank our participants, reviewers, the study team, and finally the University of Michigan for supporting this work. Thank you.